Hello and welcome to a discussion from a plastic surgical standpoint of vein disorders and treatment options. We'll give you an overview of the venous anatomy system as well as abnormal conditions of the veins. We'll discuss the workup, the examination, the treatment, and outcomes. The cardiovascular system contains obviously the heart as well as the blood vessels, which include arteries, capillaries, and veins. The venous system has a combination of deep veins as well as superficial veins. The superficial veins include the saphenous vein as well as the small veins that are visible on the surface of the skin. Now, a normal vein is a vein that has the ability to carry blood out of the leg, carry it in one direction, and it has good valve competence. Veins that go bad include disorders of the superficial veins, known as varicose veins. When the capillaries, or the smallest vessels in the body, go bad, you'll develop telangiectasia or spider veins. And when there's deep vein problems, you can often develop what's called chronic venous insufficiency. Vein-related disorders include problems with discoloration, swelling, ulcers, restless leg syndrome, deep venous thrombosis, as well as superficial venous thrombosis can occur. Unfortunately, these conditions tend to be chronic, progressive, and are somewhat difficult to treat once they become established. And therefore, if someone's developing varicose veins at an early stage, it's very important to seek potential treatment if you are developing some of the symptoms such as heaviness, tiredness, achiness, as well as possible thickening of the skin, redness, rashes, ulcerations. Now, the varicose veins that develop do occur primarily because the valves in the veins go bad. The valves help and assist and aid in the one direction of blood flow from the lower leg to the upper leg. And when the veins are incompetent, the blood will flow the reverse direction, resulting in a buildup of pressure and a buildup of distension of the vein, which causes dilatation and eventually a worm-like vessel that's noted under the skin and is quite visible as a varicose vein. Varicose veins again, are quite superficial, they're easily visible, so they're both a cosmetic problem as well as a medical problem. Varicose veins affects roughly 10 to 20% of the population, and there are many risk factors involved in the development of varicose veins, including a strong family history, being female, having children, working on hard surfaces, as well as having a history of trauma, obesity, and a history of smoking as well as excessive sun exposure. Telangiectasia are tiny little capillaries that are in the skin that dilate, and they have either a purple or a dark red color. And while these are small, they can still be symptomatic, and they can be problematic from a cosmetic as well as, again, significant amounts of discomfort can be associated with these as well. The spider veins can occur by themselves or along with more significant problems with varicose veins or venous insufficiency. Now, the chronic venous insufficiency is another disorder of the venous system that occurs when the veins that are deep in the leg are insufficient, have bad valves, and carry blood the wrong direction. This can be a very serious condition, causing severe swelling, eventual ulceration, and difficulties with significant heaviness, tiredness in the legs. The condition is progressive and can result in very severe, profound ulcers that are difficult to treat medically. Restless leg syndrome is essentially the feeling that one must or needs to move the legs constantly. This occurs during the daytime but is more prevalent at night and is theorized to occur when excessive blood irritates the muscles in the legs. Deep venous thrombosis, on the other hand, is a blood clot in the deep venous system. This can be either acute or chronic. In the acute form, you'll often have severe, significant, sudden swelling, discoloration, pain, and this is a condition that is potentially life-threatening as the blood clot can break off, embolize, travel and migrate to the lung and result in a pulmonary embolism. Superficial venous thrombosis is a condition in which the superficial veins develop a blood clot. This condition is associated with significant pain and discoloration on the surface. It is more limited and localized. It's often associated with hardness and induration, And this condition is not a medical emergency. However, it needs to be treated oftentimes with warm compresses, non-steroidal anti-inflammatory agents, as well as antibiotics. It is usually a self-limiting condition, however, rarely can progress to DVT as well. Now, prevention of varicose veins is a very important component of care, and if one can catch the varicose veins early, there are some things you can do non-surgically to improve your outcome. Wearing compression stockings that are medically prescribed by your physician is a helpful way to reduce the severity of the problem. Varicose veins are also treated with exercise, smoking cessation. You need to avoid prolonged standing if at all possible, avoid excessive sun tanning, as well as avoiding prolonged crossing of legs. Now, a varicose vein treatment with a compression stocking involves the use of a moderate compression stocking either to the calf, thigh, or in a pantyhose form. The compression is greatest at the ankle and the lower leg and helps to push the blood out of the lower leg and to allow the patient to have less blood accumulating where there will be damage to the tissue. Now, in evaluation of varicose veins, we're going to assess our patients for overall generalized health. We're going to recommend an ultrasound to evaluate for ruling out deep venous thrombosis. We're also going to evaluate the saphenous vein, which is another superficial vein that runs the entire length of the leg from the medial ankle to the thigh, to assess as to whether or not this vein is also propagating or promoting the problem. We have 3 different treatment modalities that we generally use. The first is applied to telangiectasia. This is an in-office treatment that takes roughly a half an hour to perform and is done by injecting the telangiectasia with a sclerosing agent. This is known as sclerotherapy. The treatment oftentimes is repeated 2 or 3 times to give the maximal improvement possible. Each treatment usually gives a 50 to 70% improvement in the appearance of the telangiectasia. And occasionally this is a treatment that is done even more frequently for those patients that respond more slowly. Also, treatment of the varicose veins that we call varicosities are done with 2 different modalities. The first is an ambulatory stab phlebectomy, in which we make small, tiny incisions 2 or 3 millimeters in length in a progressive fashion over the abnormality to allow us to grasp and separate and remove the vein piece by piece until we removed anything that's visibly present on the surface of the skin as a varicosity. This is a minimally invasive procedure. It's well tolerated. Within 2 to 3 weeks, we allow patients to return to all activities, including exercise. We do recommend the patients wear compressive hose for the first 2 or 3 weeks, and after that, that's an optional treatment option for the patient. Another treatment is the Elvis procedure. This is a mnemonic for laser-assisted saphenous vein ablation. This is done in a very minimally invasive fashion in the operating room under sedation, in which the patient has a needle placed into the saphenous vein with ultrasound guidance in a lower position near the calf. Once the fiber optic cable is placed and it's advanced to a more proximal location in the top of the leg, it is actually literally hooked up to an external laser. The laser then is able to have the light and the heat applied inside of the vessel to actually literally sear the inside of the vessel to cause it to collapse. And then the cable is slowly withdrawn until the entire length of the vessel is treated. This is a nice advancement in that there, again, is only 1 small needle poke, and the entire leg is treated with very little trauma, very little recovery time. In fact, most patients are back to normal activity within 1 to 2 days, and the recovery is very similar to any other vein stripping procedure, in which for 2 or 3 weeks the patient will wear compression stockings, and also after 2 or 3 weeks can resume all activity, including exercise. Some of the risks of the varicose vein treatments include risk of infection, bleeding. There's a tiny risk of a deep venous thrombosis developing. Also, there are discomfort and constraints of wearing the compression hose and dressings. But the vast number of patients have a marked improvement and feel tremendous relief, usually within the first 2 or 3 days of the procedure, with decreased discomfort, heaviness, tiredness, and achiness in their legs, even while they're still recovering from the acute phases of surgery. In conclusion, I would just like to state that vein treatment in the modern medical practice has come a long way, that we have an excellent number of procedures we can perform to ameliorate the difficulties with severe varicosities of the superficial veins as well as the saphenous vein. We also have excellent treatment for telangiectasia with sclerotherapy, and therefore this is an area of practice that's quite rewarding, fulfilling, and many happy patients leave our office after their treatment.